Hello everyone, I'm Dr. Fadi Abi Azar. I'm a plastic surgeon from Lebanon and certified trainer for Pluryal Academy. Today I will be introducing the holistic approach for the Pluryal products, and we will be using all the range of Pluryal fillers on this patient. So we have this beautiful patient. She's 40 years old, and we have already discussed in the consultation what she feels about herself. She says that she feels tired and her face is starting to sag. So you can see around her eyes like she's starting to have hollowing under her eyes. Her temporal area is also starting to be hollow. She is lacking projection of the cheekbone. Her nasal jugal groove is starting to show slightly. She has her nasolabial folds also showing. A little bit of the jawline starting to appear. As we have talked, during the aging process, we start losing volume from the face. On this patient, we see clearly on the mid-face that she is starting to lose the volume. You can check this on the profile view, where you can see the nasal jugal groove that is starting to form, the jaws starting to appear also, and dropping of her eyebrow. During the aging process, we always lose volume of fat, especially from the lateral side of the face. That's why we always see, like here, the nasal jugal groove and the nasolabial fold. So this part, usually we should not inject in it. On the contrary, we have to do a lifting effect of this area to get back the volume to the lateral side. Whenever we do injection of fillers, we have some principles to think of. First of all, we should always inject on the upper side of the face and then go downwards. And always we go from the lateral part and then to the medial part, because we always have to restructure the face, and then we do the refinements after we do the restructuring of the face, like maybe doing the lips, the tear trough, maybe also the cheeks. During the aging process, we always lose volume from the face, especially on the lateral part, and we don't lose on the medial part of the face, especially the nasolabial fold. So we should not inject in these parts. First, we're going to start with the temple area. We will be filling this area. Here we have the cheekbone. That we will also be filling. After that, we have to go to this triangle, because we have to blend the cheek and this area to do the lifting effect. Then we will do the gonial angle. Then we will work on the cheek and the tear trough, or the suborbital area. At the end, we will be working also on the Marionette triangle. Her chin has a very nice projection, so we will not be using any fillers in the chin. Like we said before, we always start from the top and then we go down to the bottom, and laterally, and then we go medially. The first thing we're going to start with is the temple area. I personally like the gunshot technique, where I do a bolus of filler on the deep periosteum. So there's another technique where we can use the cannula and put it superficially subdermally, but I prefer the other technique because it's smooth and it doesn't show the product. For this, I will be using the Pluryal contour. We always start with disinfecting the area. The technique I use is I always palpate the temporal crest, And here I have already marked the orbital rim. What I do is I go laterally 1 centimeter and upwards 1 centimeter. You can sometimes see the veins that are superficial. Like you have to avoid them when you inject. If you see there is a vein passing in this point, you can just take the skin to the side laterally or medially just to not to go through the vein. You will now feel a small pinch. 1, 2. So you go all the way to the bone. You aspirate. And then you start injecting slowly. The Pluryal Contour Lidocaine is one of my favorite products, if not the favorite, because it has a high G' and a high lifting capacity. Whenever you inject, always inject slowly so that the patient doesn't feel any pain. I used here 0.5. I always use the minimum is 0.5 for the temporal area. You can massage it a little bit, and you have always to tell the patient that they will be feeling pain tomorrow and the day after, whenever they open their mouth. After doing the temporal area, I will be doing the zygomatic arch. Also here we have two techniques. We can use the needle or we can use the cannula. And if you want to use the needle, it's better to use a thick filler like Contour Lidocaine. I will be using here volume Lidocaine and use a cannula. You always touch the zygomatic arch. You don't have to go deep whenever you do the hole. I try here also to go to the lateral soothe. And you have also to blend the temporal area. So I used here 1 milliliter. Now that we have done the cheekbone area, now there will be a hollow in the pre-auricular area or premasteric area. That's why we have also to fill this triangle. I will also be using here Pluryal volume lidocaine, and I will inject it superficially. So I fan it. I will also use 0.5 here. And then you spread it with massaging. Now we will move to the gonial angle and also to the base of the nasolabial fold. I will do boluses in both sides just to lift them up. Usually I don't treat a lot the piriform aperture, but with some patients, when we get older, the piriform aperture gets wider. So we need to just give it a little bit of lift to push the upper lip forward. Also, whenever I will be using Pluryal contour lidocaine, whenever I do a bolus, I go very deep to the bone. So I touch the angle and I go straight to the bone. I will be putting 0.25. I don't have to do the aspiration here because there are no veins or arteries. The facial vein and artery pass in front of the masseter muscle. So they pass in front of the masseter. You can ask the patient to grind their teeth. So you can feel the muscle, okay. The artery has this trajectory. It passes like near the commissure of the lips, then goes inside the nasolabial fold, goes here to the side of the ala. Then from here it will be called the angular artery, and then it goes up. The vein it passes in the nasal jugal fold, and then they both meet here. So here also, it's a danger zone. You have to go all the way to the bone. You should aspirate here. And inject 0.25. Now I will be working on the infraorbital area. I always use the cannula for this area because it has a lot of vessels and it can bruise easily. I like to use Pluryal Classic lidocaine also for this area, so I will be treating the tear trough and the lateral infraorbital, like the junction between the cheek and the eyelid. I do the whole. I go deep, and I like to inject small boluses on the way just to anesthetize this area so the patient doesn't feel any pain. When I introduce my cannula, I give small boluses just for the anesthesia so that the patient would be comfortable. Then I go deep to the bone. Then I go lateral, also to the bone. Like there will be a point where you cannot pull up the cannula, it will be stuck. That's how you know that you're in the right plane. I go very deep when I do this. So to fill the lateral soothe. Then I massage it. I always remove the cannula, check where needs to be filled more. And we're done with under the eye area. The last part of today's treatment is going to be the marionette area. As we all know, like we will be losing volume in this area and the skin will be sunken. We have to give back a little bit of volume to have the smooth transition between the cheek and the chin. I will also be using Pluryal volume lidocaine here and using the fanning technique subdermally. So I will do a small hole, 1, 2. So first I go in the marionette, I go all the way up to the lip, and then I do fanning I put 0.5 cc's here, and of course I will massage it. We have now treated half of her face. She looks much more healthier now. The nasal jugal groove disappeared. Her whole eye seems wider and nicer. She has now higher cheekbones that she lost here. Her temple area is also much nicer. Her eyebrow here was already higher even before the treatment. Now, whenever we'll do the second half, it will get better. Also, her nasal, her marionette line seems higher, and we have a very smooth transition between her cheek and her jawline. Whenever we do an injection, we don't look to the syringe. We always look on the patient to see if there's a blanching effect. I always try to blend the temporal area with the cheekbone. Here the patient, she has a scar on her old orbital rim. So now I will be using Pluryal contour lidocaine for the mandibular angle. I go deep to the bone, give a bolus of 0.25. This will help give a lifting effect for the lower third of the face. And I use the rest of the syringe for the base of the nasolabial fold. Always aspirate. Now we will move to the infraorbital area. So here I always go to the cheekbone. I make sure my cannula is deep. I'm using here Pluryal volume lidocaine. This will give support to the lower lip. Now we have finished the filler treatment. I usually like to wait 2 weeks after this treatment to do skin boosters. But in this case, I will be using the Pluryal booster on the neck. The Pluryal booster has hyaluronic acid that is non-cross-linked, so it's great to hydrate the neck. And you have to do small papules intradermally. In her case, I will be focusing more the concentration on the wrinkles of her neck. You can use either a needle or a cannula, but if you want to use a cannula, you really have to be very superficial. So you do a small injection, and you have to see the papule. Try to do them spaced 1 centimeter. And we're done.